most important thing about the Christie is it's the largest single-site cancer centre in Europe. There is an incredible synergy between translational researchers, basic science researchers, clinical trialists, and also, of course, all of the NHS consultants that work in the Christie Hospital. And this is an incredible space to be in terms of trying to move forward for patient care. So this project is really, I see as a critical collaboration between the Christie Hospital and Boehringer, and its aim is to improve outcomes for L-LCNEC patients. L-LCNEC stands for Large Cell Neuroendocrine carcinoma, and our work is obviously focused specifically on pulmonary or lung cancers with this title, L-LCNEC. It's a rarer type of lung cancer. It affects, we think, about 3% of lung cancer cases. But of course, because lung cancer is so common still, then L-LCNEC is associated with significant problems which we feel like we haven't fully addressed for patients yet. I would say there are two main work streams that we've focused on in order to be able to achieve that. The first thing is diagnostic consensus and what L-LCNEC is. Currently there's concern that different pathologists in different centres and certainly across different countries are calling L-LCNEC slightly different things, and so we need to come to a definitive conclusion on what we're treating. And the second main work stream for the project is the oncological management work stream. So everyone coming to a collective decision about what the best paths of treatment are, and sometimes that's going to be based on limited evidence, and our expertise and pragmatism is going to have to be involved. L-LCNEC is difficult to diagnose almost because it's a victim of our success in general with lung cancers, and that's because technology can now get to more distant parts of the lung. But of course these biopsies unfortunately do tend to become smaller and smaller the further into the lungs you go.
Increasingly we receive smaller amounts of biopsy or cytology samples, and that in itself is a diagnostic challenge because the morphological features of large cell neuroendocrine carcinomas, L-LCNECs, as we can refer to them, they have some features that are akin to small cell carcinomas in that they have neuroendocrine features, and on the other hand, their own morphology is quite similar to the non-small cell carcinomas. And on small biopsy samples, quite often there will be crushed tissue. There won't be enough tissue to work with in terms of doing the full spectrum of markers that we would like to do. So that places us in a diagnostic quandary more frequently than not. Rarity itself creates a challenge. So the size, the number of samples that we would like to access to undertake the sort of new biomarker testing and even get sufficient patients at a single center is very challenging. So therefore it is essential to have a multi-center approach.
So the main professional body that represents lung cancer oncologists is called the British Thoracic Oncology Group, otherwise known as BTOG. And so a couple of years ago at least, I was asked to chair a special interest group for L-LCNEC for BTOG, and that means we do, I think, have an unparalleled network of people who are invested in this challenge.
I think it is important to emphasize that I think the right pathology leads to the right treatment. So I think it is a core element from a patient perspective to first of all we have the starting point as having the correct diagnosis. So once we are able to ensure that across the board, I think we'll certainly see the standards of the clinical interventions also improve. So those variations in terms of outcomes that one might be looking at now, in coming years, we should certainly see an improvement on that, and that in itself will be a big jump. So just that standardization process.
What Boehringer has done is really invested in this sort of foundational root and branch work so we can properly define an L-LCNEC diagnosis.
We are really passionate about setting up collaborations and long-lasting partnerships that will put the patient at the very center of what we do. It's about working with our customers, with our partners. It's about listening to them to make sure we understand what are the challenges, not just in terms of cancer research, but also in terms of the healthcare system. What are the challenges for the patient? rather than assuming what those challenges are.
You identify these projects, this is the moment that we can start thinking about working together, because the strategy aligns and then you believe that something can come out of this mutual interest.
For Boehringer Ingelheim, cancer care is personal. We believe that this partnership with the Christie is a groundbreaking initiative that exemplifies the power of purposeful collaboration and innovation in healthcare that will prioritize the outcomes for the L-LCNEC patient community.
And although we're not going to see the results straight away, we're paving a way for the future of these patients and the future of the diagnosis, the future of the care of these patients.
What is good to see is that there's a trajectory that we are drawing out which is clear-cut with specific objectives that are coming into play. It has been very supportive, so I'm looking forward to that interaction developing and flourishing.